just want to give my welcome again and to just say that this is clearly a really important time for all of us here. As you take a look at this year's report card, one thing that you'll certainly notice is that there's an almost even distribution between both good and bad grades. So maybe we should first talk about the good news. Well, we see that based on the report card, that deaths due to diabetes continue to decline. We see that more than 80% of women over the age of 50 have gotten mammograms in the last 2 years. We also notice that deaths due to colorectal cancers are at an all-time low since 2002. In addition, we see that strokes and heart disease rates are slowly showing trends towards improvement. So all of these things are certainly things that we should be celebrating. But having said all that, despite these great strides, there are still a number of areas where we must continue to increase our efforts. For one, like was just mentioned, we know that disparities continue to persist among women here in the state of Tennessee, among many indicators. For one, we see that African American women are still at a much higher risk of delivering a very low birth weight infant. They're at a higher risk of having an infant die before their first birthday. These same women are at a higher risk of dying from cervical cancer or breast cancer. In addition, these women are also at a higher risk of contracting sexually transmitted infections. Well, for all women here in Tennessee, we see that our obesity rates are continuing to rise. Did you know that today 1 in 3 women here in the state of Tennessee are obese? 1 in 3. The report card also shows us that social barriers continue to challenge us. The poverty and unemployment are on a rise, as well as the number of women with health care coverage. Those numbers are actually falling. We know well that these social indicators are closely tied with many people's health in many cases. So clearly, this report card and us being here today, this is really a pivotal moment. Many of us are here, before we walked in the door, we already knew sort of where Tennessee compared to other states in terms of our health, in terms of national rankings. But having said that, we all must admit to ourselves, there's nothing like having a letter grade written in ink to really hammer home the reality of what the health of the women in our state looks like. You know, when I saw this year's report card, it actually reminded me of the last report card released in 2009, only I wasn't standing up here. I was sitting actually in the second to last row. But it was a similar situation then, where there were clear areas of progress, yet a number of really important areas where there was still a lot of work to be done. And frankly, there were areas where we were failing. As both a member of the community, but also as a healthcare provider, for me, seeing C's or D's or F's told me then, and it's also telling me now, that the women in the state of Tennessee are still in the midst of a health crisis. This is a big deal. So now what? I mean, we have the report card in hand. We know the facts. We know the areas that require more attention. They're not only in black and white, but today with this report card, they're live and in living color. We can no longer just sit and just talk about what the issues or the problems are. Instead, the question that keeps echoing back at me is really, so what are you going to do? So what are you going to do? What are we in this room? What are we going to do? You know, usually after a crisis has been identified, there's a call to action. But when you're called to action, before you start out, you really need to pause and examine your context. You really need to figure out who you are, where you are, what you can do for yourself or for your family or for your organization or for any other person around you in order for you to be a part of the solution. And it's then that you can move on to identify strategic connections. One of the first things that I discovered when I moved here to Nashville a few years ago, and many of you have probably come to this realization on your own, but there's a lot of really amazing organizations out here in Nashville in this area that are doing a lot of great things. They have a number of fantastic programs or resources that are available to women in the community. But having said that, you know, I'm actually married to a gentleman sitting in the back. He's actually a pastor of a little church here in Nashville called Mount Zion. We have about 24,000 members. 65% or more are women. And one thing that we began to quickly realize was that many of the women in our congregation had no idea of the resources that were available to them, that were free or subsidized, or that they can get on a sliding scale at very low cost. They had no idea. So we realized that we needed to figure out how to connect these people, these women in our congregation and in the community, to the resources and the programs that were really available to them. And as a result, Full Circle was born. Full Circle is actually a nonprofit organization that we established around this time last year to serve as a community connector, one of the community connectors. Our mission is simple: to improve the health of the greater Nashville area by connecting people with resources and resources with people. That's simple, right? Connecting people with resources and resources with people.